Hemochromatosis. It's a genetic disorder that causes the body to absorb too much iron from food. This leads to iron buildup in organs like the liver, heart, and pancreas. If left untreated, this excess iron can cause serious health problems, even life-threatening complications. The condition is often rooted in a mutation in the HFE gene. This normally helps regulate how much iron the body absorbs. When the gene malfunctions, iron levels in the bloodstream increase, and there's no natural way for the body to remove the excess. This iron then settles in your tissues, primarily in your liver, and then it gradually causes damage over time. Hemochromatosis was first described medically in the late 19th century. But it wasn't until the 1990s that a scientist identified the specific genetic mutation responsible for most cases. They found that people of Northern European descent were especially susceptible, with the highest prevalence in individuals of Irish, Scottish, and English ancestry. Interestingly, researchers have uncovered evidence that this genetic mutation may have persisted in Northern Europe for centuries as a protective adaptation against the Black Death. Iron, when left unchecked in the body, can accelerate the growth of certain bacteria. The bacterium responsible for the plague, Yersinia pestis, is one of those. Low iron levels would have given those with the mutation an advantage, slowing bacterial spread within their bodies and possibly improving survival rates during epidemics. Today, the same mutation leaves descendants vulnerable to hemochromatosis. There's two main forms. The primary or hereditary type is the most common, and it's inherited when a person receives two defective copies of the HFE gene, one from each parent. The second type, known as secondary hemochromatosis, it isn't genetic, but it does develop due to other medical conditions like chronic liver disease, certain types of anemia, or frequent blood transfusions, which can cause iron overload. In the early stages, hemochromatosis can be very hard to recognize because its symptoms often mimic common issues like fatigue, joint pain, abdominal discomfort. And as iron levels continue to rise, more serious symptoms then emerge. Liver cirrhosis, heart disease, diabetes, arthritis, skin discoloration. They're all possible outcomes. The skin may take on a bronze or gray tone. It's a telltale sign of advanced iron overload. If left untreated, these symptoms can lead to severe complications, including liver failure, heart rhythm problems, and even certain cancers. Diagnosing hemochromatosis involves blood tests that measure iron levels along with genetic testing to make sure that we confirm mutations in the HFE gene. In advanced cases, a liver biopsy might be necessary to assess damage. Treatment is straightforward and effective if started early. For people diagnosed early, managing hemochromatosis can be quite simple. Just very simply avoid iron-rich foods, limiting vitamin C intake, and reducing alcohol consumption to protect the liver. Understanding hemochromatosis is crucial, especially for people of Northern European descent who are at higher risk. Early diagnosis and intervention can make life-changing differences, allowing people to manage the condition and avoid serious health issues. Recognizing and treating hemochromatosis offers a way for those affected to protect their health and well-being for the long term. These are Interesting Things with JC.